Hi, this is Michael Altos, and we're talking about the GI system and antihistamines, and this is part 1. Histamine is a substance that occurs naturally in the body. It mediates inflammation, as we see in patients who have allergies, and it's secreted from cells including mast cells and basophils. There are two kinds of histamine receptors. The H1 receptor we should think of as the allergy receptor. When the H1 receptor is stimulated, it leads to smooth muscle contraction in the respiratory and the GI systems, pruritus, which is itching and sneezing, and release of nitric oxide, which causes peripheral vasodilation. It decreases conduction through the AV node, causing bradycardia, and causes coronary vasoconstriction. The H2 receptor I think of as the GI receptor. It stimulates secretion of acid in the stomach and also increases myocardial contractility and heart rate and leads to coronary vasodilation. The H3 receptor I think of as the negative feedback receptor, which means that it inhibits synthesis and release of histamine, and it may have some overlap with H2 receptors as well. So if a patient gets an H2 blocker and it also blocks the H3 receptor, then actually the patient will have a blockage of their negative feedback loop and they will synthesize excess histamine. And this could be especially dangerous if a patient also gets a drug that evokes histamine release, like, say, morphine. The cardiac effects of histamine include flushing, hypotension, decreased systemic vascular resistance, and increased capillary permeability, which leads to edema, and positive inotropic and chronotropic effects in some dysrhythmias. The respiratory effects of histamine are bronchoconstriction, especially in patients who have pre-existing asthma or COPD, and increased production of nasal and bronchial mucus. In the GI system, we see constriction of the intestinal smooth muscle leading to increased bowel peristalsis and diarrhea, as well as increased gastric volume and acidity. Histamine antagonists, or antihistamines, are used to relieve the effects of allergic rhinoconjunctivitis, which is a typical allergic reaction, as well as pruritus and urticaria, which are hives. They also provide some protection against bronchospasm. Antihistamine toxicity looks a lot like anticholinergic poisoning, and in extreme cases can lead to seizure and cardiac dysrhythmias. There are two kinds of H1 antagonists, or antihistamines. These drugs are very selective, which means they have very little action on the H2 receptor. The first generation are the sedating antihistamines, with significant effects on the muscarinic, cholinergic, and serotonin receptors. The side effects that we are most likely to see are somnolence or sleepiness and the anticholinergic effects. Patients can also have some cognitive impairment. Specifically, we may see tachycardia, dry mouth, blurred vision, urinary retention, and impotence. The classic example of a first-generation H1 blocker is diphenhydramine, or Benadryl, which can be used as a sedative, an antipruritic, or an antiemetic. Its dose is between 12.5 and 50 milligrams IV with a half-life of 3 to 9 hours. It can be used to block histamine-mediated vasodilation that occurs during anaphylactic and other allergic reactions. And the side effects include significant sedation and anticholinergic side effects. Other H1 antagonists that you may encounter include chlorpheniramine, which is chlortrimeton, and brompheniramine, which is Dimetapp. These agents have minimal anticholinergic side effects, and in fact can lead to some significant paradoxical CNS stimulation instead of somnolence. Hydroxyzine, or Vistaril, is also an H1 antagonist, used for sedation and anxiety, as well as motion sickness, vertigo, and nausea and vomiting. It too has significant anticholinergic side effects. The second generation H1 antagonists are the non-sedating. This is probably because they don't cross the blood-brain barrier, and so their effects at the muscarinic, cholinergic, and serotonin receptors are minimal. The best example of these are loratadine, which is Claritin, and fexofenadine, which is Allegra. We'll stop the recording here and continue in the next video. Please let me know if you have any questions about the material.